is very minor, but in one area it's a high percentage. I was told that I couldn't have brachytherapy because I have a very enlarged prostate, and that my only alternatives were prostatectomy, or robotically, or cryotherapy, or electrobeam therapy, none of which I want to do. I'm 72 years old, have type 2 diabetes, and I just don't want to have any lack of quality of life. So I'm listening to your radio station.
All right. Well, I'm glad you called, and you're really smart for calling beforehand. First of all, brachytherapy can be done on larger prostates, and we commonly do that. And there's studies that show you have the same benefit. So you have a Gleason 7. You have a Gleason 7 cancer, so your Gleason was 3 plus 4 equals 7. And if you had surgery, let's say, your success rate is only 60%. And usually, for most men, surgeons will not operate over the age of 70 because the death rate and complication rate goes up. So you not only you have the high Gleason score, but you have an age which puts you at significant risk for radical surgery. So I would say exactly the opposite of what the doctors told you, and that is that radical surgery for you has a higher morbidity and possible chance of death, mortality. At best, their success rate is 60%. Most likely, they'll take away your sex life and your urinary life. With us, we've treated about 3,000 men like you. Our success rate's 90%, and most likely you'd be cancer-free, and most likely you'd keep your sexual life and urinary life.
May I ask you a question, please?
Yeah, sure.
Does my PSA at this point matter? Because it was 18. Is that significant?
Well, that's the data that I'm talking about. So it just shows you have a substantial risk because your PSA is 18 and your Gleason 7, but that's all the more reason to get treated. Because look, a typical man your age is going to live another 20 years, and you don't want to have a recurrence of prostate cancer and spread to the bones and die a painful death. It's something no one wants. No one wants that. So, you have a good chance to be cured. It's not perfect, but a good chance, and certainly better with us than with those other methods you mentioned.
Yeah, it's very interesting. Without naming names, I had a head doctor at a big hospital who's written books on urology, and these are the alternatives he told me.
Well, we can go over that in private, but, urologists are surgeons, and they earn their income from operating, and people have to understand that there's most likely a bias. Now, what's interesting is a lot of urologists are buying up radiation centers. So I think in their heart they believe radiation's better. The question is, do the patients get to hear that and benefit from that? And then, therefore, what is the best type of treatment? And if you look at our booklet, you'll see that the treatment in the radiosurgery frame and brachytherapy gives you the best chance. In our hands, about a 90% chance for a Gleason 7 to be cancer-free.
Great. May I ask you another question, please?
Sure.
What is the difference between external beam radiation and radiotherapy?
Well, there's different ways of administering radiation. So radiation or radiotherapy is just one name for radiation or two names for radiation. When we give radiation, we do it in the most precise way because the prostate is sitting between the bladder and the rectum. So if you think about it, when they operate, they kind of have to fillet the fish. They have to open up the body. They separate out the bladder and the rectum, pull out the prostate, which is surrounded by the nerves, and then try to sew you back together again. We try to use the most precise method of radiation called treatment in the radiosurgery frame and brachytherapy. Brachytherapy is we're putting seeds in the prostate, and we're looking at your prostate at the same moment. And I do it. It's not students or residents. I do it. I've done 3,000 cases. And we actually can see where the prostate is and put the seeds where we want them to go, rather than randomly. So it's very different. All those different names, radiosurgery, radiation, radiotherapy, are really referring to how precise the treatment is.
Right. And is this as precise as proton therapy?
Well, if you look at our data, actually, I'm glad you mentioned that, because if you look at our data, we have a comparison to us versus proton beam. Let me just get you that data. On page 16 of our booklet, Us versus Proton Beam. If you look at Gleason 7 cancer, Proton Beam has a 76% success rate. We have an 87% success rate. So our treatment's done faster. It's about half the time, 14% better results. So
generally speaking, how many treatments does one need to get radiotherapy?
For you, in our hands, generally 25, 5 weeks of treatment, which is half the time of usual treatment, half the time of proton beam. 5 days a week, Monday through Friday. You come into our office, get treatment. Each treatment's about 15 minutes, about 15, 20 minutes, and then you go home or go to work or go to the movies or go to lunch, feeling fine.
I just want to say that, for any man to get a prostate diagnosis of cancer is very bewildering, very frightening, very exhausting, because there are so many options, so many people saying so many different things. So, I'm glad you took my call, and I'm going to get your booklet or whatever information I need to follow up. Does diet play an important part in this whole process?
Well, we know in general people that keep a good diet, exercise, don't smoke, drink in moderation will reduce their cancer rate by up to 50%. So it's obviously helpful. But you have cancer now, so diet's not going to take care of it for you. You need treatment.
No, it's not going to get rid of it.
Right. So for the other people. Watchful waiting is not going to help you. You're at very high risk. You have a high PSA, high Gleason score. You're at very high risk. So I'd encourage you very strongly to come in and let's spend an hour or two and go over all the data. Our booklet's helpful because it has all the data in it, but when we sit down and go over it in person, it's even more helpful.
Can I call your office to get the booklet?
Yeah,
How do I do that?
Just call us 212-CHOICES, 212-246-4237. 212-CHOICES, and we'll mail you a booklet and DVD at no charge.
Okay, great. I appreciate it. Lastly, can I ask you another question, please?
Sure.
There's other kinds of treatment, one called focal laser ablation. There's a doctor that does that in New York, where they do it with an MRI or something guided, or cryotherapy. They all have side effects.
Well, not only do they have side effects, but they're really considered unproven as primary treatment. There's two methods of treatment for primary treatment of prostate cancer that are approved. It's surgery or radiation. Most of these others are secondary treatment if the first treatment doesn't work, and they're not considered proven primary treatments.
What would you do if you had this diagnosis, obviously?
I would come to Dr. Lederman because our data is the best. And if you look at higher risk men, our data is much better, sometimes 50 or 100% better than the other guys. And that's why the booklet is so important.
Yeah. How accepted are your methods in the general community?
Well, people try to copy us. But the problem is that those who copy us don't have the same results. And that's why I talked about people that use the same so-called same technique have 20, 30% less good results. So results matter. Some of it is artistic form and how the doctor gives the radiation. Not everything is the same. It's like you can have a paintbrush of Michelangelo, but it doesn't mean you can paint like Michelangelo.
Well, listen, I really appreciate the time and the precise information you're giving me, and I will call your office tomorrow, get the booklet, and as soon as I'm sort of think that I have some kind of flu or something, so I've been kind of exhausted waiting for my energy to come back.
All right, well, give us a call, and God bless you, and thank you.
And thank you.
Bye-bye now. We have Kenny on the line. Kenny, good morning.
Hello, good morning, Doc. Great show, fascinating.
Thank you.
Pretty healthy guy. I keep hearing the MRI, the CAT scan, the PET scan for the prostate. Which one is better? And also, I keep hearing the Gleason score. Now, I'm not too familiar, but I keep hearing you say like a 4.3. Is there such thing as a 3.4 or
3+? Gleason was a pathologist. He tried to tell us how aggressive a cancer would be. He made a scale of 1 to 5. So 1 is the best, 5 is the worst in two different areas. So the best you can have is 1 + 1 = 2, which almost never happens. The worst is 5 + 5 = 10. That's the worst. We're almost at the end of the hour, so I'm going to try to answer your questions. What is the best imaging? The best imaging depends on what you want to look at. If you want to look at the prostate itself, probably an MRI is the best way of imaging the prostate. If you want to look at other lymph nodes in the body, probably a CAT scan is the best way. Or if you have some question about the bone, a bone scan or a PET scan. Sodium fluoride looks at the bone, and a normal PET scan looks at other parts of the body. Again, I'm almost out of the hour, so just call me. You can call later today at 212-CHOICES, and I'll answer your questions. So thank you, Kenny, for calling. I look forward to speaking to you in detail later. For others who we didn't get to, just give us a call at 212-CHOICES. We'll mail you a booklet and DVD, so you'll have that. Thank you very much for calling, and thank you for listening. God bless you. Have a great week and great health.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 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 212-CHOICES,